Hello everyone. Am I live? Am I back? Can you see me? Can you hear me? Give me a thumbs up in the chat box if I'm clearly visible, audible. Give me a minute to confirm if I'm clearly visible, audible. I guess it's working. Yes, I guess it's working. So I welcome you all for this session also. I am Dr. Priyanka Sachdev here. I'm sorry. And today I'm here to continue my series of bacteriology. So in bacteriology, we are going to study all the bacteria one by one in a unique comparative tubulated manner as we have discussed. So yesterday we have studied Staphylococcus completely. And today we have started Streptococcus. In the last lecture, you may be knowing that we already started Streptococcus. So I'm going to teach you bacteriology in a comparative manner. These are the common headings under which we are going to describe all bacteria. You may be knowing my method of teaching in which I in this unique way of teaching bacteriology, I compare various bacteria in a tubulated manner so that students have better retention. If you learn it in a comparative manner, you can remember and you can compare the various bacteria. But if you remember them individually, don't make tables, comparative tables between them, you will forget. Once you study Staph aureus, you will remember it. But once you start studying Streptococcus, you will remember, you will forget the Staphylococcus. So this is a way you should study bacteriology. The first thing. We have already started Streptococcus pyogenes in the first lecture. Now we have completed the introduction. In the introduction, I always tell you the name of the scientist who has discovered that bacteria. So what is the name of the scientist? I have told you the name of the scientist is Bile. So here the scientist name was Alexander. Staphylococcus was discovered by Alexander. Streptococcus is discovered by Bile. We have covered this portion. In the classification, yesterday I taught you the classification of Staph aureus, and today in the morning in the first lecture I already taught you the classification of the Streptococcus. Classification is based on 4 criteria. First, based on oxygen requirement, we see aerobes and anaerobes. Based on hemolysis on the blood agar, we divide into alpha, beta, gamma hemolysis. The beta one are further divided based on C carbohydrate component in the cell wall into 21 classes. 21 categories, group A to group W. This classification is done by Lansfield. That's why known as Lansfield classification. Group A among them is further divided into 80 different types based on the M protein in the cell wall, and this classification is done by Griffith. So this is known as Griffith classification. In the last lecture we have completed this classification, right? After that we have started the morphology. In morphology we always study 3 things: capsule, spore and motility. So we have seen that Staphylococcus are non-capsulated, non-spore forming, non-motile yesterday, and today also the same thing we have seen with Streptococcus. They are non-capsulated, non-spore forming, non-motile, and both of them are gram-positive cocci. We have seen that both of them are gram-positive cocci, right? The culture media, yesterday we have completed the 6 culture media for Staphylococcus. Today in the morning we have completed 4 culture media for the Streptococcus. We have already completed the 4 culture media. What are the 4 culture media we have completed? One is blood agar, second is selective agar, the selective media, third is transport media, and last is liquid one. So you tell me one word. I guess everyone have attended my last lecture. So you tell me the answer of that. So on blood agar, it is beta hemolysis. In selective agar, there are 2 selective agars. Blood agar containing crystal violet and blood agar containing PNF, right? Transport media is Pike's media. You know the composition of Pike's media. And liquid media, there is turbidity in the liquid media. Here is the point where we have left the last lecture. And I'm continuing the lecture by biochemical reactions, via biochemical reaction of the Streptococcus. So let me start the biochemical reactions of the Streptococcus. I am going to teach you the biochemical reactions. You have to enumerate the biochemical reactions here, whatever I am telling you right now. The first biochemical reaction is a negative reaction. It is catalase negative. This catalase negative is to differentiate it from Staphylococcus. You may be asking me that, ma'am, if it is negative, why you are telling this finding to us? If it is negative, so it is negative, but this negative finding is very important. We want to differentiate Staphylococcus from Streptococcus by using catalase test, right? So catalase is the enzyme. Both of them are gram-positive cocci. So first we apply a catalase test. How to apply catalase test? I will tell you. Catalase test. If they are positive for catalase test, they are Staphylococcus. And if they are negative for catalase test, they are Streptococcus. So basically Streptococcus are negative for catalase test. So these are catalase negative. You have to learn that. How to perform catalase test? Yesterday also in Staphylococcus I told you. Can you see? You have to take a slide. Take a slide. Take a glass slide. Take a glass slide. This is your specimen. This is your specimen. Now you want to know whether it contains Staphylococcus or whether it contains Streptococcus. This specimen contains some gram-positive cocci. You only have two options, Staphylococcus or Streptococcus. You want to differentiate whether it is Staphylococcus or Streptococcus based on catalase test. So you take a glass slide. On the glass slide, take 1 drop of H2O2, hydrogen peroxide. This is 1 drop of H2O2, hydrogen peroxide, and add 1 drop of your specimen. 1 drop of your specimen. Mix them with a stirrer. Now, there are two options. If the specimen contains Staphylococcus, catalase is present in that. Staphylococcus contains catalase. We know that catalase enzyme. Catalase enzyme will split the H2O2 into H2O and O2. So oxygen bubbles are formed. So after mixing the specimen, you can see the bubbles. You can see the bubbles arising out. And if the specimen contains Streptococcus, so Streptococcus don't have catalase enzyme. Catalase is absent in them. So H2O2 will remain as H2O2 only after mixing. It will not convert into bubbles. So basically you have to look for bubbles after mixing. So if bubbles are coming, it is catalase positive, it is Staphylococcus. And if bubbles are not coming after mixing, it is catalase negative, it is Streptococcus. Give me a thumbs up if you got it. Give me a thumbs up if you got it. So what is Staphylococcus? What is Streptococcus? It is the Staphylococcus is catalase positive, the Streptococcus is catalase negative. How to perform the test? Take 1 drop of H2O2 and mix it with specimen. Here also take 1 drop of H2O2 and mix it with specimen. Now if the specimen contains Staphylococcus, the H2O2 will be splitted into oxygen bubbles. You can see the bubbles. And if the specimen contains Streptococcus, the Streptococcus do not contain catalase enzyme. So H2O2 will remain as H2O2 only. Oxygen bubbles are not formed. Give me a thumbs up. Abhijit, you got my point. So this is how you have to perform catalase test. This is how you have to perform catalase test. So first thing, it is catalase negative. The first thing, the first biochemical reaction. The second biochemical reaction is also a negative reaction. It is insoluble in bile, 10% bile. So take the colonies of Streptococcus pyogenes and try to dissolve it in bile. It is insoluble. You will see, ma'am, if it is insoluble, it is a negative finding. Why you are telling this to us? I want to differentiate it from some bacteria. What is the classification I taught you? Tell me the classification of Streptococcus. Abhijit, can you tell me the classification of Streptococcus? Anyone else? Anil, can you tell me the classification of Streptococcus? What is the classification of Streptococcus? We classify Streptococcus based on hemolysis. Based on hemolysis. How many categories we divide Streptococcus based on hemolysis? We divide the Streptococcus into 3 categories. Alpha hemolysis Streptococcus, beta hemolysis Streptococcus and gamma hemolysis Streptococcus. So alpha में कौन-कौन से आते हैं? Alpha Streptococcus में कौन-कौन से Streptococcus आते हैं? Which Streptococcus are coming in alpha? In alpha there is Streptococcus viridans and Streptococcus pneumoniae, right? In beta there are 21 types, but the most important is group A to W are there. But the most important is group A, that is Streptococcus pyogenes. That is my chapter that I am teaching you right now. Streptococcus pyogenes. And in gamma, it is Enterococcus. Yes, Abhijit, right? Now, I want to differentiate my Streptococcus pyogenes, which is my chapter, from Streptococcus pneumoniae. So, bile solubility is the test. Both of them will form the colonies. But here, the one difference is that here alpha hemolysis will be there and here beta hemolysis will be there. This is the first difference. After that, one more difference is there. Here colonies are soluble in 10% bile. They get dissolved in bile. Here colonies are insoluble in 10% bile. So this test is to differentiate Streptococcus pyogenes from Streptococcus pneumoniae, not to differentiate from Staphylococcus. We have done a catalase test to differentiate it from Staphylococcus. We have done a bile solubility test to differentiate it from Streptococcus pneumoniae. Both these tests are negative in Streptococcus pyogenes. So basically, Streptococcus pyogenes, if you talk about Streptococcus pyogenes, what is my chapter right now? Streptococcus pyogenes. So the first biochemical reaction, it is catalase negative. It is catalase negative. The first biochemical reaction, it is catalase negative. The second biochemical reaction, it is bile insoluble. It is bile insoluble, 10% bile insoluble, right? I am performing these. So both these tests are negative. Both these tests are negative. The first is to differentiate it from Staphylococcus, which is catalase positive. The second is to differentiate from Streptococcus pneumoniae, which is soluble in bile. Which is soluble. Now give me a thumbs up if you got these negative findings. So write down these 2 negative findings for Streptococcus pyogenes to differentiate it from the other bacteria. Everyone give me a thumbs up. Everyone. So this is the second biochemical reaction. Now negative findings are important here, right? Coming on the third. What about sugar fermentation? Does it ferment sugar? Yes, it ferments sugar. It ferments all sugars. It produces acid but no gas. It is not a gas forming bacteria. You can see yesterday also I have taught you how to test for sugar fermentation. You take sugar in a test tube. This is a test tube containing sugar. You add your specimen containing bacteria in this. If the bacteria ferment sugar, acid will be formed, and because of the formation of acid, color change will take place. Color change in color is indicating that acid is formed and sugar fermentation already taken place, right? There is another test tube inside this test tube, inverted test tube. Can you see this inverted test tube inside all these test tubes? This inverted test tube is known as Durham test tube. This test tube is to see whether gas is formed or not formed. You got my point? Okay. Listen, the point is that the summary is that sugars, there are many sugars available. It can be sucrose, it can be maltose, it can be glucose, it can be galactose, it can be sorbitol. There are many fructose. There are many sugars available. Any of the sugar can be there, right? Bacteria ferment sugar. So if you take a bacteria, the bacteria have the enzyme. Various bacteria have enzymes to ferment various sugars. Bacteria ferment sugar. Whenever a sugar is fermented, two things are formed. The first thing, acid. Acid is always formed. Gas can be formed, gas cannot be formed. With gas or without gas. So this is the fermentation of the sugar. You should know the basics. Fermentation of the sugar leads to acid formation with or without gas. Gas can be there, gas cannot be there, right? So for all bacteria, you have to tell me acid is formed with gas or without gas. So here we take two test tubes. The first test tube contains the sugar and the inverted test tube is the Durham test tube. In the Durham test tube, you look for the bubbles. You look for the bubbles. Bubbles are present, means gas is formed. Bubbles are absent, so no gas is formed. So here for streptococcus, my topic is here is streptococcus now. So you take the two test tube. This is the first test tube. It contains sugar. Fill the sugar in this. Fill the sugar in this. The sugar is this, and take another test tube. Another test tube is Durham test tube, which is the inverted test tube inside this. Now add your specimen here. This is my specimen. I am adding my specimen. My specimen contains Streptococcus pyogenes. On adding the specimen, what will happen? What will happen? You tell me what will happen. The change in color of the sugar will take place. Change in color of the sugar will take place. So sugar will change from red to another color. The sugar color will change. That is, acid is formed. Acid is formed, but you cannot see any bubbles in the Durham. Durham mein bubbles nahi hai, so no gas is formed. So sugar fermentation takes place, acid formation takes place, but no gas formation takes place. Give me a thumbs up. So that is the summary. So this is the summary written in front of you. Many image-based question can also be asked. You should know the basics. Give me a thumbs up. So that was the third. That was the third biochemical reaction. Coming on the fourth biochemical reaction, PYR test, which is very important. What do you mean by PYR? PYR is an enzyme which is present inside the Streptococcus pyogenes bacteria. What is the full form of that PYR is? PYRS. So it is a big thing. So you have to learn it is pyrrolidonyl. That is P. Pyrrolidonyl. PYR. Right? Naphthylyl amidase. This is the PYRS. PYR enzyme. So it is a big name. You can learn like PYRS only. This test is done to confirm. So you take this chemical. You put the bacteria. If the bacteria contains the enzyme, it will convert this chemical into free beta naphthylamide, and change in color from yellow to red can be seen. Yellow to red color change can be seen. So to confirm, so if you want to know, I'm having a specimen with me. I want to know whether my specimen contains Streptococcus pyogenes, yes or no. I want to know. It can be present, it can be absent. I am not sure. So what do? You do a PYR test. How do you do a PYR test? Take the PYR in a test tube. Put your specimen. So if color change takes place, means enzyme is present, bacteria is present, and if color change not taking place, it is negative. So it is PYR positive. So this is PYR test. Yellow to red color change. Yellow to red color change. Give me a thumbs up. Everyone give me a thumbs up. This is PYR test. Before that, I have taught you the sugars. Before that, I have taught you two negative things. So let me summarize the biochemical properties of Streptococcus pyogenes. Who will tell me the four biochemical properties of Streptococcus pyogenes? Two are negative, two are positive. So it is catalase negative to differentiate it from Staphylococcus. Staphylococcus are catalase positive. It is bile insoluble. It is bile insoluble to differentiate it from Streptococcus pneumoniae, which is bile soluble. Right? It ferments sugar, but only acid formation, no gas formation. Right? And it is PYR positive. It is PYR positive. So this is the summary. In short, you should write the summary. Everyone give me a thumbs up. Everyone means jitni audience utni thumbs up. You should appreciate it. How simplified manner I am telling you the bacteriology. No one will tell you bacteriology in such a simplified manner. Give me a thumbs up. Culture, we have already completed the culture. The 4 culture media I have told you. What will happen on blood agar? what will happen on selective media, what will happen on transport media, and what will happen on liquid media. So you tell me the summary. You tell me the summary. चारों का summary बताओ. In blood agar you will get beta hemolysis. Selective agar are two. Blood agar containing crystal wallet and blood agar containing PNF. I guess everyone knows the full form of PNF. It is polymyxin B, neomycin, and fusidic acid. Right? Transport media is only one, Pike's media. I have told you the composition of the Pike's media also. Pike's media is a blood agar containing crystal wallet and sodium azide. And in liquid, you will get the turbidity. You will get the granularity and turbidity. That's it. So there are four culture media and there are four biochemical reactions. So 4 plus 4, 8 you should know. So any question can be framed from this. Any question. Yes, Abhijit, you are absolutely right. Absolutely right. So 4 culture, 4 biochemical reactions. After that, I must come on antigenic structure. I must come on antigenic structure. Give me a thumbs up. So antigenic structure is not really very important. So just I will show you the diagram. This is the diagram of Streptococcus pyogenes. Can you see? This is the diagram of Streptococcus pyogenes. The outermost, you can see this one. This is the capsule. You will say, ma'am, you told us it is non-capsulated bacteria. I told you it is non-capsulated bacteria. But I have told you few of them are capsulated. And the capsule is made up of hyaluronic acid. Hyaluronic acid. Hyaluronic acid capsule is there. Rarely in few species it is present. Not much. And innermost is the cell membrane. This is the cell membrane. और उनके बीच में है cell wall. उनके बीच में है cell wall. Cell wall have 3 components. Can you see the orange, red, and blue? Orange one, red one, and blue one. So innermost is the peptidoglycan layer. After that, you have group C antigen in the cell wall. Group C antigen जिसके basis पे Griffith classification है. उसके बाद में you have proteins in the cell wall. MTR3 proteins. Okay, I will draw it for you. I will draw. So innermost is the cell membrane. Let me draw. This is the cell membrane. Right. Outermost is the capsule. Let me draw a capsule. This outermost is the capsule. This one is the capsule. Capsule is rarely present, not always. Hyaluronic acid. This is hyaluronic acid capsule. It is not present in all. In between the cell membrane and the capsule, there is cell wall. Cell wall have 3 components. Cell wall have 3 components. The innermost is the peptidoglycan component. This one is the peptidoglycan component. Uske baad, there is group C carbohydrate antigen in the cell wall, based on which there is Lensfield classification, which has divided the bacteria into 21 types. So this group C antigen, group C carbohydrate is of 21 types. So it is A to W. 21 types are there, based on which we have done the classification. And outermost, the third one here, this third one is the protein. There are 3 type of protein, MTR. So these 3 type of protein, basically M protein is 80 different types, based on which Griffith classification is done. So Griffith has classified the bacteria into 80 different types, serotype 1, 2, 3, 4 till 80, based on the M protein. So this is the composition. Everyone give me a thumbs up. This is the antigenic structure. We all have understood it. So nothing important in that. Let me move ahead. So after that, resistance is not important. Antigenic structure. So till here we have done. You know the introduction, the name of the scientist who has discovered it, Bill Roth. You know the ways how to classify it, Lensfield, Griffith classification, you know it. Morphologically, it is non-capsulated, non-spore forming, non-motile. It is a gram-positive foci. We know that. Culture में the 4 culture media I have already told you: blood agar, selective agar, transport media, and liquid media. Right? Biochemical reactions I have already told you the 4 biochemical reactions. 2 are negative. Catalyst negative, bile insoluble. Bile negative, bile insoluble, and 2 are positive. It ferments sugar, but only acid, no gas. And last one was the most important is PYR positivity. Right? After that, antigenic structure, I have already told you nothing important. Resistance, you can leave, nothing important. Let me come on the next, virulence factor. The most important is the virulence factor. Before that, I would like to launch some questions in the form of the polls till now. Are you people ready for the polls? Would you participate, Abhijit, Akruti? Would you participate, Anil, in the poll? I want everyone to participate. This is the first question in front of you. Please, everyone, give me the answer. This is the first question in front of you. Tell me the answer. Which of the following selective media, which of the following is the selective media for Streptococcus pyogenes? Tell me the name of the selective media. Is it blood agar? Is it crystal wallet blood agar? Is it potassium telluride blood agar? Or is it a chocolate agar? Tell me the answer. Akruti, Abhijit, Anil, anyone who is watching me live. Tell me the answer. Yes, tell me the answer. What is the answer for this question? What is the I have told you 2 selective media for the Staphylococcus, for Streptococcus pyogenes. So you tell me selective media for Staphylococcus also, and you tell me selective media for Streptococcus pyogenes also. Staph aureus का मैंने कल बताया था. You have attended my yesterday's lecture. Staph aureus, aureus का भी बताओ, दोनों के selective media बताओ. So here also I taught you 2 selective media, here also I taught you 2 selective media. Staph aureus के yesterday's answer, yesterday's I have taught you 2. It is Ludlam's media and mannitol blood agar. Yesterday I have taught you 2 media there. In the Streptococcus pyogenes also today I taught you 2 media. It is blood agar containing crystal violet and blood agar containing PNF, that is polymyxin B, neomycin and fusidic acid. So what is the question asked? Come on the question again. Come on the question again. I'm asking for Streptococcus pyogenes in the question. So either of the two option will work. So in the option I am having blood agar with crystal violet. Yes. So answer will be B. Absolutely right. Answer will be B. Right. Akruti, it is not C. It is B. If I change the question, C is a selective media for Corynebacterium diphtheria. If I ask the same question, selective media for Corynebacterium diphtheria, your answer will become C. Right. Chocolate agar will be for Neisseria. So different bacteria have different selective media. You should know the selective media for all bacteria. All 40 bacteria, the selective media at the tip of your tongue. कोई रात को नींद से भी उठा के किसी भी बैक्टीरिया का सेलेक्टिव मीडिया तुमसे पूछ ले तो you should know the answer. It is that way important. It always comes in the form of MCQs in your exam, the various selective media. So till now I taught you 2 bacteria. Yesterday I taught you Staph aureus. Today I am teaching you Streptococcus pyogenes. So you should know the selective media of them and comparative manner. Everyone give me a thumbs up. Everyone give me a thumbs up. Should I proceed? Correct answer here is B. Okay. So okay, only one question was there. So coming to the virulence factors now. I'm coming on virulence factor of Streptococcus pyogenes. In virulence factor, we have 2 things, toxins and enzymes. We have toxins, we have enzymes. Let me talk about toxins. How many toxins this bacteria have? I'm talking about Streptococcus pyogenes. How many toxins does it have? Is it having 2 types of toxins? Hemolysins are the toxins which causes destruction of RBC in the blood. Hemo means RBC, listen means destruction of RBC. And pyrogenic toxins are the toxins which the word pyro means hota hai fever. They cause fever, right? Hemolysins are of 2 types, SLO and SLS, right? Oxygen stable and oxygen labile. One is oxygen stable, and one is LS is S for stable, and LO means oxygen labile. So one is based on the oxygen stable hai ki oxygen labile, it is of 2 types, right? This one is stable in presence of oxygen, this one destroyed in presence of oxygen. So one is oxygen labile, one is oxygen stable. There are 2 types of hemolysins. And pyrogenic are of 3 types ABC. These are of 3 types ABC. Let me teach you the details. Hemolysins are of 2 types, streptolysin O and streptolysin L, SLO and SLS, streptolysins, right? One is oxygen labile, and one is oxygen stable. So the 2 are there. This one, okay, just a second. The oxygen labile, this one is oxygen labile. Let me write it. I want to tell you something. This one is oxygen stable, as I have told you. Oxygen labile one is antigenic. This one is non-antigenic. What do you mean by that? Imagine this is the blood vessel of a human in which Streptococcus pyogenes bacteria have entered, causing sepsis. This is the bacteria. So bacteria will secrete toxin inside the blood. So as I have told you, both toxin will come in the blood. Both hemolysin will come in the blood. SLO will also come in the blood. SLS will also come in the blood. Both the hemolysins are coming in the blood, right? After coming in the blood, human body will form antibodies against this. Antibodies against this will not form because this one is antigenic, this one is non-antigenic. Give me a thumbs up if you got the meaning of antigenic, non-antigenic. So antibodies are formed against this one. What's the name of the antibody? The name of the antibody which is formed against this one is ASO, anti-streptolysin O. This is streptolysin O, so the antibodies are formed against this is anti-streptolysin O. Imagine in my clinic there is a patient. Having some complaint. So I am suspecting the patient is having an infection of Streptococcus pyogenes because of the toxin. He is having some infection. So what I will ask the person to give the blood in a test tube. And in the test tube, I will test the antibodies against SLO. I will not test SLO. SLO ke against antibody I will test, antibody titer. Because if SLO is present, body ne uske against antibody banaya hoga na. So this is known as, the name of the antibody is anti-streptolysin O, and the test is known as ASO test. So ASO titer is very important. In the patient, I will ask the patient to do a ASO titer and come back with a report. If ASO titer is positive, the patient is having infection of Streptococcus pyogenes. Give me a thumbs up if you got it. Give me a thumbs up. So that is about ASO test. You got my point? ASO test. It is strongly antigenic, ASO, anti-streptolysin, and ALS is non-antigenic. It is oxygen stable but non-antigenic, right? So that is the summary of these two toxins, nothing important. One is oxygen labile, one is oxygen stable. The labile one is antigenic, the stable one is non-antigenic. That is the summary. Give me a thumbs up if you got it. Give me a thumbs up if you got it. Coming on the pyogenic toxins. Pyogenic toxins. The pyogenic toxins are of three types. These are known as streptococcal pyogenic exotoxins. Streptococcal pyogenic exotoxins. These are of three types, A, B, C. A, B, C. These are super antigens, and as they will cause fever. The name of the fever is scarlet fever. As I told you, the word pyro means fever, right? They will cause a fever and the person will have red rash throughout the body. That is known as scarlet fever. This is scarlet fever. It is produced by the second. Now you should know all. This is scarlet fever. There is also in this scarlet fever, the patient has strawberry tongue. Can you see the tongue of the patient? It is looking like a red tongue with some granularity. It is looking like strawberry. So strawberry tongue is seen in scarlet fever. It is seen in scarlet fever. It is also seen in other diseases, in Kawasaki disease, toxic shock syndrome disease, B12 deficiency. But scarlet fever is one of them in which strawberry tongue is seen. Give me a thumbs up. Everyone give me a thumbs up. Everyone. So that is about the toxins. What about enzymes? I've told you two virulence factor, enzymes and toxins and enzymes. How many enzymes? There are many type of enzymes present inside the bacteria. DNase, streptokinase, hyaluronidase, protease, SOF, anidase. So just learn the name. Don't go in details. Just learn the name. So let me summarize the virulence factor. There are two types of virulence factor. There are some toxins. There are some enzymes. You should know the two type of toxins, hemolysins and pyrotoxins. Hemolysins are two type, SLO and SLS. One is oxygen labile, one is oxygen stable, one is antigenic, one is non-antigenic. Pyrotoxins are of three types, ABC. They cause scarlet fever. They cause scarlet fever. There are many enzymes are also present. You should know the names. Let me come on the diseases. Tell me the name of the diseases which is caused by the bacteria. How many diseases are there? So this is the summary of the diseases. How many diseases is caused by this bacteria? It causes suppurative diseases in which pus is formed in the body. And it causes non-suppurative diseases in which no pus is formed in the body. So let me first teach you suppurative disease. Streptococcus pyogenes I am teaching you. The another name of Streptococcus pyogenes is group A beta Streptococcus. Is it right? It is a group A Streptococcus. Landsfield classification ke according it is group A and it is beta. It is beta hemolysis. So beta Streptococcus. This is the another name given to this bacteria. Give me a thumbs up. So suppurative में ये तीन तरह के infection कराएगा, respiratory, skin and others. So in the respiratory it will cause sore throat. It will cause sore throat. Can you see sore throat? The pus in the tonsils. It is causing sore throat. Sore throat, tonsillitis, pharyngitis. Sore throat is there. It will cause sore throat. It will cause scarlet fever. Scarlet fever में भी patient have first respiratory infection and then fever and then the rash over the body, red rash over the body. It is due to SPE-ABC toxin. You know it is due to pyrotoxin. You know it is due to pyrotoxin. इसमें strawberry tongue भी होगा patient को. And third, others. Others में the patient can have pus anywhere in the body. The pus can be in the peritonsillar area, retropharyngeal abscess, in the ear otitis media, in the mastoiditis, in the Ludwig angina, suppurative adenitis, the pus in the brain, heart, bone, joints, anywhere pus can be there. So respiratory infection, skin infection पे आ जाते हैं. In the skin infection, the patient can have erysipelas. You know what is erysipelas? Erysipelas is this one. Can you see? There is a pus filled. You know there is a pus, right? Erysipelas. So the pus in the lymphatics. The pus in the superficial lymphatics is known as erysipelas, right? You see the pus in the superficial lymphatics. It is known as erysipelas. It is giving a appearance of orange. Have you seen an orange fruit? Santra. Hindi mein said as santra. You eat santra. It is looking like an orange. It is known as PDU orange. It is known as PDU orange appearance. This appearance is known as PDU orange appearance, right? It is impetigo. Impetigo. Can you see? This is impetigo. It is looking like honeycomb. Can you see? This is erysipelas. It is looking like orange. So honeycomb appearance or PDO orange arrangement. PDO orange. So all this is the pus formation. Pus formation. Impetigo also pus is formed. And this is the impetigo. Can you see? It is looking like a honeycomb. Honeycomb. Cellulitis can be there. You know cellulitis में deep tissue में pus है. Cellulitis can be there. Necrotizing fasciitis can be there. The fascia will be necrotized because of the pus. You know necrotizing fasciitis can be there. Just learn the names. Just see the images and learn the name. So in the skin, it can be erysipelas, it can be impetigo, it can be cellulitis, it can be necrotizing fasciitis. You have seen the images, you have understood the diagrams. In the respiratory infection, it can be sore throat, it can be pharyngitis, it can be tonsillitis, right? And others may pus can be there anywhere in the body. Anywhere their pus is their body. So these are the suppurative infection. Suppurative infections are not so important. The non-suppurative one are more important. Here no pus is found. So there are two non-suppurative infection. One is acute rheumatic fever, one is post streptococcal glomerulonephritis. Everyone give me a thumbs up. इस पे maximum MCQs आते हैं. So these both are caused by Streptococcus pyogenes. Streptococcus pyogenes, which is group A beta streptococcus, beta hemolytic streptococcus. Give me a thumbs up. So what is non-suppurative about them? How not pus is not formed, still the person have infection. How it happens? So let me talk about the first acute rheumatic fever. So let me tell you a story. Let me tell you a story of rheumatic fever. Can you see a child? This is a child. The child is having tonsillitis because of group A beta streptococcus pharyngitis, that is Streptococcus pyogenes, right? That is Streptococcus pyogenes, that is my chapter. So you will say, ma'am, okay, pharyngitis to hota hi hai. I've told you the diagram, pus is there in the tonsil. So body is forming antibodies against the bacteria. Can you see? These are the antibodies against the bacteria. Body is forming antibodies. The antibodies will kill the bacteria. Bacteria is not causing anything, it is just causing sore throat, and these are killed by the antibodies. But the antigen which is present on the bacteria, the similar antigen is present on 5 human organs: the heart, the brain, the skin, just below the skin it is subcutaneous tissue, and joints of the bone, right? So these antibodies will get confused, they will kill the bacteria. These antibodies think this is also bacteria because there is antigenic similarity. So these antibodies will come and do the destruction of these 5 organs. So these 5 organs have 5 diseases. In the heart, the patient have rheumatic heart disease. In the brain, the patient have syndrome scoria. In the skin, the patient have erythema marginatum. In the subcutaneous tissue, the patient have subcutaneous nodules. And in the joints, the patient have migratory polyarthritis. The 5 diseases together is known as rheumatic fever. Rheumatic fever is an umbrella term having 5 diseases. अच्छा ये 5 diseases किसने कराई? 1, 2, 3, 4, 5. किसने कराई? Who is causing these 5 diseases? Is bacteria causing the 5 disease? No, the bacteria is dead. The bacteria is killed by the antibodies. Bacteria is not coming in the organ. In the organ, these are there is no bacteria in any of the organ. Any of the 5 organ doesn't have any single bacteria, any single Streptococcus pyogenes. No. So that's why it is non-pus formation. There is no pus in the organs. Organs में pus नहीं होगा because bacteria is not coming. Bacteria is already killed. So who is causing the disease? Autoimmunity. Body's own antibody are killing body's own tissue. These autoantibodies, because of confusion, they are doing so. Give me a thumbs up. So that is the story of rheumatic fever. Give me a thumbs up. Everyone give me a thumbs up. The same story occurs in the kidney in acute rheumatic fever also. So these are 2 non-suppurative complications of Streptococcus pyogenes in which bacteria do not cause the disease. The antibody against the bacteria is causing the disease. So that is about the pathogenesis. I wish I could continue, but you know, at 10 o'clock, I'm having next lecture on the Unacademy platform. So I'm having a scheduled lecture there. So unfortunately, I have to end this lecture. If you want to study pharmacology, by me, in pharmacology, I am teaching CVS pharmacology. I am going to teach you heart failure drugs and antihypertensive drugs. So come on 10 o'clock, at 10 o'clock, after 5 minutes on the platform, on the Unacademy platform. It is a free class. Don't worry. Like YouTube only, it is a free class. But the only thing, it is not on YouTube, it is on Unacademy Learners app. Install Unacademy Learners app and come there if you want to study pharmacology now, right? I'm ending this lecture. I will continue the microbiology tomorrow. And just a second, there are few announcements for you. Thank you very much for being with me. I really enjoyed teaching you. Hopefully same from your side also. Have you learned today? Is bacteriology become easy for you? Have you got the way how to study bacteriology? Write down in the chat box. Have you got it? So I will continue the whole bacteriology in the similar way. Tomorrow is a day of studying 2 bacteria. Till now we have completed Staphylococcus. We have completed, about to complete Streptococcus. So first I will complete Streptococcus tomorrow. Then I will start the next bacteria, Pneumococcus, and then Neisseria meningitis and Neisseria gonorrhoeae. So tomorrow we are going to continue with 3 bacteria. So it is Pneumococcus and Neisseria meningitis, meningococcus and gonococcus. So these 3 bacteria I am going to cover tomorrow. So the first lecture is 7:30 in the morning. The second lecture is at 8:30. So 7:30 I will teach you Pneumococcus and 8:30 gonococcus and meningococcus. So don't dare to miss tomorrow's lecture in bacteriology. Right now, I'm having next lecture at 10 o'clock, where it is a free lecture. Not on YouTube, it's on Unacademy app, Learners app. Install Unacademy Learners app, go to NEET PG category, you can find me live there. The only thing, you require a code to join it. It is a free lecture, but you will require a code. I'm giving you the code also. The code is Sachdev10. You use this code to unlock any of my free lecture. The code is Sachdev10, that is my surname, Sachdev10. So the code is SACHDEV, Sachdev10 without space. It is in continuation. Use this code to come on the platform and watch me live. I'm going to teach you CVS pharmacology, heart failure drugs there. And on Unacademy, we have, this is the free classes. We have paid version also. Now, free classes, I will teach you few important topics, but in the paid version, we will cover all 19 subjects completely cover to cover. So if you want to take the benefit of the paid version, there are three type of paid version: Plus, Iconic, and Lite. In Plus, you will get only Unacademy live and recorded lectures. In Iconic, along with Unacademy, you will get Prep Leader also. And in Lite, you will get only test series. The various plans are in front of you, the various duration and prices. You can notice one thing: longer the plan, cheaper it is. Go with the longer plan. If you're a first prof, second prof student, 4-year, 3-year plan, it is more cost effective to you per month wise, right? So you can imagine, if the free classes are so beneficial, how the paid version will be. You can imagine whatever plan you are choosing according to your choice wish. If you want to purchase, apply the same code Sachdev10 before payment. You will get maximum discount by the team, that I can guarantee. So if you want to get maximum discount from the team, apply code Sachdev10 before payment, SACHDEV, Sachdev10. Thank you very much. The code is useful for all students. This is the summary. If you want to take the paid classes, and if you want to study only free classes, whatever is your wish, the code is useful for you, right? If you want to take the paid version, if you apply this code before payment, you will get maximum discount, right? And if you want to watch only free classes, not the paid version, you can unlock any of the free class of Unacademy using this code. So I want your help in distributing this code SACHDEV10 on your batch group, seniors, juniors, inters, all MBBS or medicos throughout the globe, all the medicos throughout the globe, so that everyone can get benefit of the free knowledge as well as the discount. Thank you very much. Bye bye. Study hard. Join me on the platform after 2 minutes. Bye bye.